is Sarah Carnes, and this is my informative speech on scoliosis. Sit up straight is a common everyday saying, but what if a person cannot sit up straight? What happens when the back has a severe curve that is slowly increasing in size with every breath, making a struggle just to breathe? Over 6 million people in the United States are affected with scoliosis, according to the National Scoliosis Foundation website accessed on February 25, 2013. Including me, I have found out that I had scoliosis in 7th grade. At that time, it was a 36-degree curve. Screening a child at a young age, finding scoliosis can start the healing process sooner. Beth Blinker, the author of A Dangerous Curve, published in American Journal of Public Health magazine 2012, states that 33 U.S. states mandate or recommend school-based scoliosis screening. Medical professionals believe that failure to screen for scoliosis would result in putting thousands of adolescents at risk for developing very real and at times disabling conditions. Today, I'm going to tell you what I know about scoliosis, like what it is, what causes it, symptoms, and treatments. What is scoliosis, you may ask? Well, scoliosis is an abnormal lateral curve of the spine, which means the spine goes to one side. Scoliosis is a serious condition that can, in extreme cases, lead to intolerable pain or compromise organ function, which can lead to death. The spine of the human being may naturally curve a little bit, but if the person has scoliosis, the spine will curve more like the letter C or the letter S. Scoliosis is divided by the group of the individuals fall into by age. Infantile scoliosis is a label given to infants that have scoliosis. Juvenile scoliosis for children from the age 4 to 10, and adolescent scoliosis occurs in older kids 11 to 18. If a person is born with curvature of the spine or abnormal bone growth of the spine, they fall under congenital scoliosis. Finally, the last scoliosis is called neuromuscular scoliosis. It is where the muscles aren't functioning right because of the nerves within the body. Neuromuscular scoliosis can lead to cerebral palsy or spina bifida. Scoliosis occurs in both boys and girls, but girls are more likely to have scoliosis. Now that you have a better understanding of what scoliosis is and who it affects, we can move on to what the symptoms are. Symptoms can range from back pain, or a person may notice that they cannot sit or stand for long periods of time. They may also see that one hip is shorter than the other hip. As the curve increases, the danger increases. Breathing problems can be affected, and the heart function struggles due to added pressure. This is my personal reason for having surgery. Struggling to breathe was scary, not to mention when my back muscles would spasm. I would suffer from chest pains. When scoliosis happens in an infant stage, it can lead to spinal damage and paralysis, according to Dr. Jacobson of the Marshfield Clinic. Last access, March 7, 2013. U.S. National Library of Medicine, access March 2013, states that there is no known cause for scoliosis, but some believe there might be a genetic tie. Understanding the symptoms, and we don't really know the cause of scoliosis, so let's twist towards the treatments available for scoliosis. I have read where some believe the screening for scoliosis should end in the schools, but that is how mine was first caught. Physical therapy is the first step to treating scoliosis, if caught soon enough. My scars were too far to be treated with physical therapy, so the next treatment plan that was available was a back brace. The back brace is to hold the spine in the correct place. My back brace started at my chest and ran down to the top of my hips. After wearing a back brace, the person might have to have surgery still, depending on how well the brace worked. Having a surgery will give the surgeon a chance to set everything straight or back to normal as possible. An estimated 30,000 children are put into a back brace for scoliosis, while 38,000 patients undergo spinal fusion surgery, according to the National Scoliosis Foundation website access on February 25, 2013. Today, we have twisted to discover that scoliosis is a curvature of the spine. We examine the different kinds of childhood to adolescent scoliosis. And we now understand that we really don't know the cause of scoliosis, and then turn through the symptoms, all the way from slight curve with no pain to struggling just to breathe. Finally, we checked out the treatments, ranging from monitoring the spine to utilizing the brace. And when we reached the large curve needing major back surgery with rods and screws, so the next time you hear someone tell a person to sit up straight, it will trigger in your memory back to what you learned today about scoliosis.